Hello. There are many problems in healthcare. One of the big ones is the inability to understand medical treatments. What you need to know is the net treatment benefit for patients like you who have been treated in the past. We call this the treatment score. You take the gross treatment benefit, subtract the negative side effects to come up with the net treatment benefit for the patient. The higher the treatment score, the greater the treatment benefit as summarized from the existing medical literature. Whenever you get diagnosed with an illness, any illness, cancer, the common cold, or diabetes, you need a list of treatments with treatment scores. The treatment list should include every treatment from every different medical specialty. The treatment list should include Western medical treatments, Eastern medical treatments, herbal medications, and every other form of alternative medical treatment. Sometimes alternative medicines have great clinical studies behind them, and sometimes they have a treatment score of 0 because they do not have studies in human beings that support their use. You need to know exactly what the situation is. Your doctor should be able to pull out their cell phone and show you the list of treatments with treatment scores for your diagnosis. You should be able to pull out your smartphone. You should be able to see the same list of treatments with treatment scores. You should be able to click on each treatment score and see the underlying data. You should be able to make adjustments, doing shared decision making with your physician based on your own values and preferences, which may change the treatment score. This is how you can do personalized medicine and how evidence-based medicine and shared decision making can be done together with your physician. Who needs treatment scores? Well, of course, patients, doctors, and nurses need treatment scores. Who else needs treatment scores? Healthcare journalists, healthcare publishers, and multimedia giants need to be writing articles with treatment scores for the web and the mobile web. They need to be making videos with treatment scores and TV shows with treatment scores. Hospitals, medical schools, and residency programs need treatment scores. Every medical residency and surgical residency should be calculating treatment scores when they do journal club. Insurance companies and governments around the world need treatment scores. Where do treatment scores come from? Well, treatment scores software is a universal calculator to calculate medical treatment effects using evidence-based medicine guidelines and shared decision-making. What physicians and medical studies can give you today are things like the hazard ratio, odds ratio, risk ratio, relative risk ratio, and number needed to treat. What you really need to know is the treatment score. You need to know the net treatment benefit for the patient. You need to know the net treatment benefit for patients like you who have been treated in the past.